I'm Rudy. I'm very proud to be the clinical director of EvoDental. We're, as far as I know, the only UK-based group of clinics that focuses entirely on full arch or full jaw reconstruction for patients who either have no teeth or are facing the loss of the rest of their teeth. So our clinics are set up to perform full jaw implant surgery and design and manufacture full jaw implant prosthetics and fit them on the same day. So it's a life-changing treatment every single day in our clinics. Last year we reconstructed 548 jaws, and this year we hope to do a lot more. So EvoDental has been around for a number of years, and since 2014 we made the decision to focus exclusively on full jaw reconstruction. And the reason for doing it was quite simple. The science of a full jaw reconstruction is completely different to any other area of dentistry, including single tooth implants, in fact. And we learned from experience and frustration and complications that when you do something that involves trying to marry together dentistry, aesthetics, bioengineering, dental material science, dental technology, all of these things sort of combined, you need to just focus on that one thing, because there's so many different elements to it that we're very pleased that we made that decision, because it means that on a daily basis we get to do one thing and we get to do it really, really well. And that's why ultimately patients travel from a long way to come and see us. People who come to us don't come to us complaining about gum disease or tooth decay. They come to us complaining about lack of confidence or an inability to enjoy their food, or avoiding social situations, going to a restaurant and ordering soup because they're too embarrassed to order food that they might have to chew, or watching that video on Facebook, the old grandma blowing her candles out on her birthday cake and her dentures flying out of her mouth in front of her grandkids. These are things that petrify people who have sort of oral disease as severe. You or I may not have that, but people who suffer from this type of disease mostly do it silently. And so by the time they come to us, it's a big deal. It's a really big deal. It's a big life event for them. So being geared up to do the entire process from beginning to end, discreetly, but also in a day, it's genuinely life-altering for them. And often the thing at the consultation that they're just sort of clinging on to is to hear us say the words, "Yeah, we can do this." You look at their scan and you look at it and say, "Yeah, we can do this." It's probably the first time they've ever heard that. And they may have been to 3, 4, 5 other dentists before us. And that is, that and the moment that you reveal their teeth on the day of surgery are the two sort of key moments in their journey.
Hi, my name is Izabela Turek. I'm a lead clinician in Liverpool. The patient that we are seeing every day, they come with different problems. Most of them they suffer from the gum disease. So, the World Health Organization says that it's up to 50% of the people around the world, they suffer from some form of the gum disease. Obviously, we're treating only the ones who suffer from the severe bone and gum loss, which lead to the tooth loss. So the majority of our patients. Other patient that we see is too much of a dentistry, failing crown bridge work, also implant work from the past. We also see patients which have parafunction, so severe grinders or clenches, bruxisms, which is usually combined with some possibly eating disorders, so they have failing teeth even in a young age. We see patients which are edentulous and they've been told previously that there is no solution for them because they don't have enough bone, except maybe major grafting and zygomatic implants. Here in EvoDental, we have a solution for most of those patients. We are able to place the implants and actually immediately load them, which basically means that they coming in with the problems and they're leaving on a day with a first set of provisional fixed teeth.
my name is Jess and I'm a resident clinician at EvoDental in Heathrow. Evo Essential is our entry-level product which provides full jaw fixed teeth without compromising on aesthetics or function. It's a graphene-infused biopolymer. Combining that with our dental polymer gives us the closest possible mimicking of natural chewing function. Evo Essential provides 10 fixed teeth for the upper jaw and the lower jaw, and the World Health Organization recommends that as the sort of normal amount of teeth to restore health and function.
I'm Simran Chagga. I'm going to talk to you about the Evo Advanced. This is our most commonly prescribed solution. This is a graphene-infused polymer veneer with a titanium subframe. This gives it more rigidity and durability than the Evo Essential, and this increased strength allows us to improve the profile and improve the comfort of the prosthesis as well. As well as getting additional implants, this will allow us to give us better front to back support for the prosthesis and in turn more teeth. So for patients with broader smiles, this is a more suitable solution.
Evo Ultimate is the pinnacle of what EvoDental have to offer at the moment in terms of the prosthetics. Under the skin, it's the same as Evo Advanced with the metal substructure and the same number of implants. But with the Evo Ultimate, the outer layer is made of a material called zirconia, which allows us to give it a slightly higher level of aesthetic finesse, as well as being able to fit it into smaller spaces with the same amount of strength. So this is available to anyone who is interested in Evo Advanced, but additionally it's more ideal for certain types of patients. So this is the kind of thing that will be discussed at your clinical assessment, but particularly for younger patients that may have not lost as much bone during their disease process as some of our older patients, they might feel themselves more drawn towards the Evo Ultimate, which is a far more beautiful product. Ultimately, the biggest advantage that we have here is that it's not just a dentist that you see, it's not just a dentist with his nurse. It is an entire team that is geared towards delivering this really pretty complex sort of treatment solution in a series of seamless steps. Take the day of surgery, for example. You would come in the morning and you would have at least 2 nurses, at least 1 or 2 dentists, 2 or 3 technicians working just on you for the entire day, so that by the time it gets to 5 o'clock, you can walk out of the doors wearing a set of fixed teeth. That's not a small thing, because to be able to achieve this in a general dental practice would be nigh on impossible, because you don't have the facilities, the laboratory, or the sort of technical expertise to be able to walk out of the clinic and into the lab and then back into the clinic again so seamlessly. So for me, the team approach is the reason that this type of treatment should really only be done in an environment like this. And that's why me and our team of sort of 55 strong people comes into work on a daily basis, because we know that we're providing life-changing care for people and we can't do it in any other kind of environment. If you're one of the millions of people out there that needs this kind of treatment, don't sit and worry about whether you're suitable or not. Just come and spend an hour and a half with us. It's a free clinical assessment. You're under no obligation to have any treatment, but what you'll learn about yourself and your condition in an hour and a half is worth coming for alone. You'll have a 3D scan. We'll be able to talk you through every element of what we do and show you how we do it, and leave you with a much better understanding of what's possible. And if it's not possible or it's not suitable, or there's a better solution out there for you, we'll talk about that as well. So come and see us.